Mr. Foster is a 44-year-old man who works as a landscaper. He is recently married with a 4-year-old daughter. 2 months ago, he was diagnosed with diffuse large B-cell lymphoma and is currently receiving CHOP therapy.
Good morning, Mr. Foster. How are you feeling today?
Same as usual since I started chemotherapy. I feel a little fatigued, but I'm able to go to work with no problem. Sometimes when I'm playing with my daughter, I have a hard time catching my breath. I have to take things a little slower.
When did you first notice these changes?
About 2 weeks ago.
At any point, do you remember having any discomfort in your chest when you took a deep breath or when you made an effort?
Yes.
Do you remember if you had any swelling of any of your lower extremities at any point?
Yes.
Okay. Well, what has happened is that on the CAT scan that we performed, it was noted that you had something called a pulmonary embolism. Now, what this is a blood clot that has likely traveled from some site here in the lower extremities to the lungs. Now, usually this comes from the circulation downstream, lower extremities or pelvic veins, and it travels, it flows, into the lungs. Now, we'd have to treat this event, and we'd also have to do a little bit more testing also.
Tests?
Mm-hmm.
What kind of tests?
Well, there's something called an ultrasound, a venous ultrasound, and it is to look for these blood clots in the veins of these lower extremities. Sometimes we don't find the clot there because it has already embolized, it has already traveled away from its origin. But if it's there, it sort of confirms, where it came from. It will not change the treatment, though. You must be treated with special medication called blood thinners because of this event. So whether you have the clot here or not is academic. Okay?
Okay.
Mr. Foster is currently receiving his 3rd month of low molecular weight heparin therapy and has not experienced recurrent VTE. He has also had an excellent early response to chemotherapy and is currently completing his planned course of treatment.